A client has experienced tonic-clonic seizure. They are now breathing normally and have normal circulation, but they have not yet regained consciousness. What nursing action will maintain their safety? Option A. Try to wake the client. Option B. Give the client a drink of water. Option C. Make a note of the duration of seizure. Option D. Place the client in the recovery position. Answer is D. If the patient has experienced seizure and the patient breathing circulation is normal, but patient is still unconscious, you have to place the client in recovery position to maintain the safety of the patient until the patient will regain the consciousness. When a patient is on oral contraceptive pill, what physical risk factor does a nurse need to make them aware of? Option A is weight gain. Option B is deep vein thrombosis. Option C is increased bleeding. Option D, acne. Answer is C. If the patient is on the oral contraceptive pill, there is a chances that patient will have the increased bleeding during the menstruation. Why does a nurse encourage family member to talk to the unconscious patient as part of their care? Option A. Verbal communication can help patient and give the family something to do when they visit. Option B. It reassures the family member that patient is going to get better. Option C. The patient is actively involved in the care process when someone talks to them. Option D. Evidence suggests that talking to the patient could potentially help them to recover from a coma. Answer is D. Evidence suggests that talking to the patient could potentially help them recover from a coma. An elderly gentleman attends the accident and emergency department with a swollen airway and has a history of allergies. What is the correct term for the patient condition? Option A is anaphylaxis. Option B is anastomosis. Option C is analgesic. Option D, anesthetic. Correct answer is A, anaphylaxis. Patient with congestive cardiac failure and non-infective productive cough will have what color sputum? Option A, white. Option B, red. Option C, green. Option D, brown. Answer is A. The patient will have the white color sputum if the patient is having non-infective productive cough. What legislation sets out the client's right and nurse's responsibility when making informed choice about medications? Option A. Health and Safety at Work Act 1974. Option B. The Disability Discrimination Act 1995. Option C. The Mental Capacity Act 2005. Option D. The Equality Act 2010. The answer is D. The Equality Act 2010. How long is the undergraduate pre-registration basic nursing program for those on a standard entry pathway? Option A 3 years, option B 2 years, option C 5 years, and option D is 4 years. Answer is A 3 years. From the following, when should feedback be offered to a newly qualified nurse? Option A, after the end of the shift. Option B, biannually. Option C, when they are on leave. Option D, continually. Answer is D, continually. A nurse has made an error documenting a patient notes. What action does she take? Option A, leave the original entry but in brackets underneath explain that there is an error. Option B, immediately destroy the documents to avoid confusion and further errors. Option C, put a line through all of the incorrect entry, record that the entry was incorrect and their name, job, title and date. Option D, inform the clinician in charge of the patient care and ask them to cross out the entry and sign underneath. Answer is C. Put a line through all of the incorrect entry, record that the entry was incorrect and their name, job title and the date. What can add quality care for patient with a dementia in acute setting? Option A. A patient wearing a specific band to indicate cognitive impairment. Option B. All patients having this is me document. Option C, a sign above the bed indicating dementia diagnosis. Option D, receiving her in a side room. The answer is B, all patients having a disease me document. So this me document provide a medical professional with the information about the person with dementia as an individual, and this also enhance the care and support given while the person is in unfamiliar environment. What is the response of parents to confirm a health education message regarding dehydration has been effective? Option A, the parent restrict fluid intake when the child has diarrhea. Option B, the parents state they will observe the child for darkening urine and the increase in respiration rate. Option C, dehydration will not be an issue if the child is taking sips of water. Option D, the parents stated they would consider restlessness as an early sign of dehydration. Answer is B. The parent stated they will observe the child for darkening urine and increase in respiration rate. The importance of correct staffing was reinforced by which report? Option A, the Baker report. Option B, the Conan report. Option C, the Drake report. Option D, the Francis report. Answer is D, the Francis report. A team leader implements a change in practice in an area of work. How do they demonstrate its effectiveness? Option A, provide evidence of the improvement through regular audit and feedback to the team and wider organization. Option B, everyone knew that the change was necessary and that is needed to happen, so no evaluation need to be made. Option C, once the change is embedded, ask staff if they are happy with the change and if has made a difference. Option D, the evidence from the research demonstrate the need for a change in practice. Answer is A, provide evidence of the improvement through regular audit and feedback to the team and wider organization. A patient with learning disability trips over and need to go to an accident and emergency department for an examination. They become distressed by the noisy waiting room. In accordance with the Equality Act 2010, what do the staff offer the patient? Option A, start call out GP for a home visit to prevent a hospital trip. Option B, staff provide the person with the learning disability a quiet place to wait. Option C, staff let him jump the queue and see him when he arrives. Option D, staff offer medication to calm the patient when he arrives. The answer is B, staff provide the person with a learning disability a quiet place to wait. What management can help increase secretion in the airway at end of life? Option A, giving diuretic and depositioning. Option B, increasing the energy and sedation. Option C, giving hyoscine butyl bromide and positioning. Option D, inserting an airway adjunct and suctioning. Answer is C, giving hyoscine butyl bromide and positioning. So hyoscine butyl bromide is used to reduce the impact of excessive oropharyngeal and or pulmonary secretion in a dying patient. Which approach does a nurse take when dealing with issue of sexuality which conflict with their own religious or cultural beliefs? Option A, approach the situation by carefully outlining and exploring their own beliefs. Option C, approach the situation by displaying active sympathy. Option C, approach the situation with a health promotion agenda to influence the person. Option D, approach the situation with acceptance of diversity and difference. The answer is A, approach the situation by carefully outlining and exploring their own beliefs. Human factors can affect the patient care. Which statement describes what human factors are? Option A, human factors are the way that staff get on with each other. Option B, human factors are those things that affect an individual's performance. Option C, human factors means only caring for patient that you like. Option D, human factors is another name for safer staffing. Answer is B, human factors are those things that affect an individual performance. After commencing a blood transfusion, at what point does a nurse first check the patient observation? Option A 30 minutes. Option B 15 minutes. Option C 60 minutes. Option D 90 minutes. The correct answer is B 15 minutes. How does a nurse measure that the policy requiring every patient admitted to a ward has a urine sample tested within 2 hours is made? Option A. Ask all staff to verbally confirm they achieve this. Option B. Undertake a clinical audit for patient notes. Option C. Put a notice up on the staff information board. Option D. Check at the start of each shift that evidence exists that the target is being met. The answer is B. Undertake a clinical audit of a patient notes. When completing a handwritten nursing note, which of the following represents best practice in documentation? Option A. Writing a name, designation, date and time of entry. Option B. Writing a name, nursing rank and rate. Option C. Providing a signature, printing a name, designation, date and time of entry. Option D. Providing a signature, designation and date of birth. The answer is C. Providing a signature, printing a name, designation, date and time of entry. What term describes the nurse's required knowledge to ensure an understanding of the need for financial planning in adult health and social care service delivery? Choose the correct answer. Option A. A knowledge of childhood disease. Option B. A knowledge of health economics. Option C. Knowledge of genomics. Option D. Knowledge of anatomy. The answer is B. A knowledge of health economics. What are the nursing priorities when helping in an emergency in the practice setting? Option A. Instruct all colleagues to help with the emergency. Option B. Ensure that all patients are informed of what is happening. Option C. Only act in the emergency within the limit of knowledge and competence. Option D. Respond to all instructions from the crisis lead. The answer is C. Only act in emergency within the limit of knowledge and competence. Which one of the following statement is an example of an open question? Option A. How may I help you? Option B. May I help you? Option C. Is that what you are looking for? Option D. Are you looking for the nurse? Answer is A. How may I help you? When does the process of discharge planning start? Option A. When the doctor states that the patient can go home. Option B. When the relatives say they can take the patient home. Option C. When the patients say they want to go home. Option D. Within 24 hours of admission. Answer is D. Within 24 hours of admission. Thank you for watching. Please like my video and subscribe to my channel. Press the bell icon to get more video. Keep watching, keep supporting. Thank you.